Good morning, Hampton Roads. It's Mary Catherine with another edition of Hampton Roads Perspectives, and we have two new guests in studio with us this morning. I want to say good morning to Dr. Dan Neumann. Hello.
Good morning.
And Amy Suder. Hello.
Good morning.
And tell us a little bit about yourselves. Dr. Neumann, you are a gastroenterologist at Gastrointestinal and Liver Specialists of Tidewater.
That's correct. I'm part of one of the largest groups of gastroenterologists here in Hampton Roads. We cover services for gastroenterology all the way from Williamsburg down through Virginia Beach, Suffolk, Norfolk, Chesapeake. Offer all kinds of services, including colon cancer screening, which we're going to talk about some today.
Yeah, we are, because it is Colon Cancer Awareness Month, which brings us to our other guest, Amy Suder. Amy, you are a colon cancer survivor or battling colon cancer currently?
I am a survivor.
Even better. That is wonderful. So tell us about your kind of journey through colon cancer, because we are going to talk about early detection, screening, colon cancer claiming 53,000 lives each year. Did you ever think this would happen to you?
Not in a million years, no.
So what brought you to this diagnosis?
I was experiencing rectal bleeding, very minor, hardly noticeable, and about a week of noticing it, I scheduled an appointment with the gastroenterologist.
And
just
so,
to have it checked out.
Just to have it checked out. You didn't think anything of it. Was there any family history?
No, not that I was aware of.
And at what age was this?
It was just before my 44th birthday. So I actually got diagnosed when I was 44, but I was 43 when I
Big shock.
discovered it. Yep.
Wow. And Dr. Neumann, when somebody is diagnosed with colon cancer, it's polyps, right? It starts as a polyp?
Well, most of the time, small polyps or small growths will turn into a colon cancer over time. Now, that's typical. On Amy's case, certainly colon cancer under the age of 50 is not something that we see all that common. So in those cases, when you actually have symptoms, those cancers can arrive without going through the normal process. So that's why we may see colon cancer in patients younger than age 50. And
you talk about symptoms. Symptoms can include fatigue, abdominal pain, weight loss, rectal bleeding. Were those all the symptoms that you had? And how long did you have those symptoms? Were they persistent?
No, I only had the rectal bleeding. I had no pain, no fatigue, nothing else other than that. So that's why it was even more shocking.
And did you immediately go right in?
About a week later. Yeah.
Wow.
Yeah.
And I mean, taking action, that's probably the best thing that somebody can do.
That's correct. And you hear some of these symptoms, and that could be, a lot of people out there have fatigue and some of these other symptoms on a daily basis, but that doesn't mean that you have a colon cancer or any other type of cancer. But you do need to pay particular attention to some of your gastrointestinal symptoms. So rectal bleeding, changes in the bowel pattern, and then certainly things like family history put you at a higher risk for colon cancer. And you want to be aware of your family history, and you want to be aware of some other risk factors that you may have.
And early detection, too, they're saying that's key. It's survived by almost 90% of patients if it's caught early.
That's correct. Colon cancer is a preventable cancer almost all the time with appropriate colon cancer screening. So the tests are available today. Colonoscopy is a very reliable test at detecting early colon polyps before they become colon cancer. So we do have the tools available. It's unfortunate that we really only screen a fraction of the population for various reasons, but it's efforts like this and efforts amongst primary care and other physicians out there to get people in to get screened.
Nice. And Amy, is there something that, Colon Cancer Awareness Month is during the month of March? Is there a walk or something that you're involved with locally, or you just get out there and spread the word for people to get screened?
I just try to spread the word.
Yeah.
That's really about it.
Yeah, that's your. I mean, but it's incredible. Yeah. It's great for you to be here to be able to tell your story, because never in a million years did you think this would be you.
No, not in a million.
And what kind of treatment did you have to go through?
I had major surgery first, and luckily they were able to get the entire tumor, and I didn't need a colostomy bag or anything. So I was grateful for that. And then because it had spread slightly to one lymph node, I went through 6 months of chemotherapy.
Okay, great. But doing wonderful today.
Yeah, doing very well. I'm almost at the 2-year mark. I'll have my 2-year scans in May, and everything looks good so far. So,
very, very good. Dr. Neumann, are you seeing a lot more cases come in? Are you seeing people who are, advocates for their health and getting early screenings and having colonoscopies before the age of 50? Are you seeing people saying like, look, I have these symptoms, let's do something about it?
Well, I think the main thing to understand is that colon cancer screening should begin at age 50. That is in the absence of any symptoms. That's in the absence of a family history of colon cancer or any other high-risk conditions. So, at age 50, you should be looking at getting colon cancer screening with colonoscopy, contacting your primary care doctor or a gastroenterologist. Some questions that you want to ask about making sure that you're getting the right colon cancer screening. You want to make sure that the physicians that you're choosing have high and appropriate adenoma detection rates. And that's an important thing because that's the rate at which these physicians are finding polyps. You know that in the general population, about 20 to 30% of patients will have colon polyps. And so it's important to know that your physicians are in that range and finding those polyps and doing adequate examinations.
Nice. If you're just waking up with us this morning, we have in studio with us Dr. Dan Neumann. He's a gastroenterologist with gastrointestinal and liver specialist of Tidewater. That's a mouthful, but we love it. Amy Suder also here, a survivor of colon cancer, again, claiming 53 lives each year, which is why we are talking all about Colon Cancer Awareness Month. Now, if somebody wants to set up a colonoscopy with you, you said you're the largest practice in Hampton Roads. Good website for them to find you?
Absolutely.
What is that?
www.glstva.com.
Great. And Amy, you mentioned earlier being 44 years old, being diagnosed with colon cancer. Is there anything else that you want to say to somebody out there listening who maybe, because I think especially too as a woman, you're kind of, you're nervous. You're like, I have this bleeding, I have these issues. What do I do? A lot of times we put our families first, our children first, our job before our needs. Do you think that being your best advocate got you to the survival mode that you're in right now?
100%. Don't wait. That's my best advice. If you think something's wrong, go in and have it checked out. I mean, best case, it isn't anything. It's something minor, which is what we all thought mine was going to be. If worst case, hopefully you've, even caught it early. So.
Wow. And early detection.
Yeah.
Early detection saves lives. And like I said, colon cancer is an avoidable and preventable cancer in most cases. And when caught early, does have a very, very high cure rate. Hampton Roads area does have one of the highest rates of colon cancer in the country.
Really?
So, we're particularly vigilant here and, being fortunate to be part of a great group of very well-trained gastroenterologists, over 40 gastroenterologists in our group. We really put a big effort on colon cancer awareness. We have, expertise in all these areas to handle things and make sure that we take care of this community.
And let's just talk a little bit. I mean, we can talk openly. We've got some time here about a colonoscopy. Again, it comes down to, being a little nervous and scared and worried. And then, a colonoscopy is kind of it's a personal procedure, but it's one that's very important. Take us through that process for somebody out there who's maybe never had one, who's approaching the age of 50. What does that kind of look like, that procedure?
Well, first of all, don't let anything you might have any preconceptions about what a colonoscopy may be keep you from getting screened. It's important to have those discussions with your primary doctor, with your gastroenterologist, because we can often put your mind at ease. A colonoscopy is a procedure where we actually visualize and look in the inside of the colon. And we will look at the entire colon. If we see any precancerous lesions, small colon polyps, or even larger ones, we can often remove those at the time of the procedure. We give you some wonderful sedation. You don't remember or feel anything.
Amy, do you remember anything?
Not a thing, thankfully. No, he's right.
Nothing, no memory.
You don't know anything.
Absolutely. Safety is our first goal. Comfort is a close second.
Great, wonderful. And it's a quick procedure too, fairly, for the most part.
Fairly quick procedure. Procedure takes about 15 minutes, often done in the office setting. We can have you in and out the door within about an hour or so. Need someone with you to drive you home because we will give you some great sedation for the test. The thing that most people are most concerned about is the preparation before the colonoscopy.
Ooh, yes.
So we do give you some stuff to drink the night before, usually Gatorade or something similar, mixed with a magical tasteless powder.
That sounds delicious.
Does do a great job at getting the bowel cleaned out because the colonoscopy is only as good as the bowel prep. So it's very, very important that you go through and you follow the instructions that you're given from your gastroenterologist to go through the bowel prep so that we can do our job and get the best visualization of that colon and keep you healthy.
Awesome. Awesome. Again, in studio with us this morning, Dr. Dan Neumann, gastroenterologist with gastrointestinal and liver specialist of Tidewater. Amy Suder, a patient, a survivor of colon cancer, again, claiming 53 lives each year. I read this statistic from the American Cancer Society. 145,000 men and women will be diagnosed in just this year alone. That's pretty incredible. I mean, that's, what is it, the fourth most common cancer?
That's raised, it's anywhere from the second to the
Oh, really?
the fourth.
Third, yeah.
The third now. That is
So we
incredible.
hope to continue to see that drop down on the list. And like I say, this is one of those preventable cancers. And with the great screening tools and techniques we have, we should be able to continue to drop that on the list.
Nice. Okay, well, thank you guys for coming in, again, spreading the word about Colon Cancer Awareness Month. What do they say? Don't sit on colon cancer? Is that the phrase out there, I think?
I think you got a winner.
Yeah, I think we do. Give them your website one more time and a good number if they want to call, if somebody's out there listening. Again, if you have these signs, symptoms, early detection is what Amy and Dr. Neumann are saying. If you've got, the abdominal pain, fatigue, weight loss, rectal bleeding, all of these persistent symptoms, definitely give them a call.
Even without those symptoms, just remember, age 50, need to start having colonoscopies every 10 years if it's normal, a little bit sooner if you have any polyps or other concerns. Certainly, if you have symptoms, you need to speak with your doctor. Don't be afraid of this test. It saves lives, saves a lot of lives every year. It's a very important part of your health maintenance. You can find gastroenterologists in this region at www.glstva.com, or you can reach us at 757-483-6100.
Awesome. Thank you, Dr. Neumann. Amy, anything else that you want to share with our listeners out there before we let you wrap up your day?
I think it's really important that we're talking about it because we do hear so much more about other cancers, and I think it's important to find out your family's history. I was asked so many times once I was diagnosed, do you know if your parents had polyps? Do you know? And I didn't. We never talked about it. It wasn't something, I knew my parents had had colonoscopies, but I just didn't know. And I did find out later that my mom had had several. They were non-cancerous, but she had several removed. And I don't know what that would have meant in terms of,
Yeah, what would that have meant?
I
Have
would
you?
have
Yeah.
had to go in sooner, or if it was something I should have been on the lookout for, but
I know it is kind of embarrassing sometimes when you go to your doctor and they ask you, what's your family history? You're like, I have no idea what my
Right.
family history is.
well, it's not something that has been talked about, I don't think.
No, a lot of times people don't speak about their family history and medical conditions within the family. But, nowadays there's a lot of information out there. You need to be well informed about what options you have as well as what's happening in your own family.
Mm-hmm. Now, Amy, will you have to get, you said scans. Will you get more colonoscopy? Like, will she have to go back in 10 years for another colonoscopy? How does that all work?
Well, I had a colonoscopy at the end of my treatment in December of 2016, and then I had another one 6 months later, which would have been last summer.
Mm-hmm.
I have one in May, and wait, I'm talking about scans. Sorry, can I do that again?
That's okay.
The colonoscopy. I'm sorry. I had one 1 year out from at the end of December.
Okay. No, it's okay.
And then I won't need another one for 3 years.
Okay.
So
That's not bad.
yeah, and then after that, I don't know what the timeline is.
Yeah. Every 10 years, though, starting at age 50 for the average person.
For the average person, every 10 years. If you have a colon polyps, usually about every 5 years. People like Amy who've had colon cancer, 1 year after the diagnosis and after the tumor is removed, and then we'll follow you up at appropriate intervals after that.
Okay, great. Well, again, I appreciate you both coming in here talking about it because it's like you said, Amy, it's one of those cancers that, not really top of mind, not many people talking about. Everybody's talking about
Right.
breast cancer awareness, bringing awareness to other cancers, but colon cancer, it's not really out there that much. So we appreciate you coming in and talking with us and sharing your story. And you've we always allow people to give shout outs. We love Dr. Neumann, but did you have a particular doctor?
I had several.
Oh, wow.
Dr. Payman, Dr. Ramirez, and Dr. Skarupa.
Nice.
My,
Great team.
gastroenterologist, surgeon, and oncologist.
Wow, incredible.
So.
Well, thank you again. Thank you, Dr. Neumann.
My pleasure. Great to be with you.
Thank you.
Thank you. And